Question 1. Analysis of a patient approaching the pharmacy counter and asking, "I saw this new medication advertised for condition, and I was wondering if it would be better than what my doctor prescribed me for the same thing." The certified pharmacy technician recognizes the medication mentioned is not on the patient's current prescription profile. What is the most appropriate course of action for the certified pharmacy technician? Option A. Inform the patient that as a certified pharmacy technician, you cannot provide advice on medications they are not currently prescribed and recommend they discuss their interest and any potential medication changes with their prescribing physician. Option B. Suggest the patient ask a pharmacist at a different pharmacy, as you are not authorized to discuss this. Option C. Provide the patient with general information about the advertised medication's indications and common side effects, as this is publicly available information. Option D. Advise the patient that the advertised medication is likely superior, and they should ask their doctor to switch them to it immediately. The correct answer is A. Inform the patient that as a certified pharmacy technician, you cannot provide advice on medications they are not currently prescribed and recommend they discuss their interest and any potential medication changes with their prescribing physician. Explanation. This scenario presents a common challenge in pharmacy practice. A patient seeking information about a medication they are not prescribed, potentially due to misinformation or a misunderstanding of their treatment plan. The certified pharmacy technician must navigate this situation with a focus on patient safety, adherence to scope of practice, and professional ethics, all within the framework of U.S. federal and state pharmacy regulations. The correct approach prioritizes patient safety and professional boundaries. By gently redirecting the patient to their prescriber, the technician ensures that any medication advice is given by the qualified healthcare professional who is managing the patient's care. This upholds the principle of do no harm by preventing the technician from offering advice outside their legal and ethical scope, which could lead to inappropriate medication use or adverse drug events. It also reinforces the importance of the prescriber-patient relationship for medication management. This aligns with regulations that define the scope of practice for pharmacy technicians, which generally prohibits them from providing direct patient counseling on medication use, efficacy, or alternatives. An incorrect approach would involve the technician attempting to provide information about the unprescribed medication. This is professionally challenging because it blurs the lines of responsibility and could lead to serious consequences. Providing information about a medication not prescribed for the patient could be interpreted as offering medical advice, which is outside the technician's scope of practice. This could lead to the patient self-medicating inappropriately, experiencing adverse drug reactions, or altering their prescribed treatment plan without consulting their physician. Such an action would violate regulations governing the practice of pharmacy, specifically those pertaining to the roles and responsibilities of pharmacy technicians and the prohibition of unlicensed personnel providing drug information or medical advice. It also represents an ethical failure by potentially undermining the prescriber's authority and the patient's established care plan. Another incorrect approach would be to dismiss the patient's concern without offering any guidance. While the technician cannot counsel on the unprescribed medication, ignoring the patient's inquiry can lead to frustration and a lack of trust in the pharmacy. This could indirectly harm the patient by leaving them without a clear path to obtaining accurate information, potentially leading them to seek unreliable sources. Ethically, this fails to demonstrate professional courtesy and a commitment to patient well-being, even within the confines of scope of practice. A professional decision-making process for similar situations involves 1. Identifying the core issue. A patient is asking about a medication they are not prescribed. 2. Assessing scope of practice. Recognize that providing counseling on unprescribed medications is outside the technician's purview. 3. Prioritizing patient safety. Determine the safest course of action to ensure the patient receives accurate information from the appropriate source. 4. Communicating professionally and ethically. Respond in a way that is helpful without overstepping boundaries, guiding the patient toward the correct resource. 5. Documenting if necessary. Depending on pharmacy policy and the nature of the interaction, a brief note might be warranted. Question 2. The audit findings indicate that prescription records for controlled substances are not consistently stored in a locked cabinet when the pharmacy is closed, and there is evidence of unsecured prescription pads in a non-restricted area. Which of the following actions best addresses these findings in accordance with federal and state pharmacy laws and ethical practice? Option A. Document the findings in a personal notebook for future reference and continue with daily pharmacy operations as usual. Option B. Dispose of the unsecured prescription pads discreetly and instruct staff to be more mindful of where they leave prescription blanks without formally reporting the issue. Option C. Immediately secure all controlled substance prescription records in a locked cabinet and report the unsecured prescription pads to the supervising pharmacist for immediate disposal and reordering from a secure source. Option D. Inform colleagues about the audit findings to ensure everyone is aware of the security lapses and to encourage better practices moving forward. The correct answer is C. Immediately secure all controlled substance prescription records in a locked cabinet and report the unsecured prescription pads to the supervising pharmacist for immediate disposal and reordering from a secure source. Explanation: the audit findings indicate a potential breach in patient privacy and medication security, presenting a significant professional challenge for a certified pharmacy technician, CPT. The core of this challenge lies in balancing the need for efficient workflow and patient care with the stringent legal and ethical obligations to protect sensitive health information and prevent diversion of controlled substances. The CPT must exercise sound judgment to identify and rectify the situation without compromising patient trust or violating regulatory mandates. The correct approach represents best professional practice because it directly addresses the identified vulnerabilities in a manner that is compliant with federal and state pharmacy laws, specifically the Health Insurance Portability and Accountability Act, HIPAA, for privacy, and the Controlled Substances Act, CSA, for security. It prioritizes immediate corrective action to mitigate risk, followed by thorough documentation and reporting, which are essential for regulatory compliance and continuous quality improvement. This approach demonstrates a commitment to patient safety, data integrity, and adherence to professional standards. An incorrect approach that involves ignoring the findings or attempting to conceal them represents a severe ethical and regulatory failure. Such actions violate the CPT's duty to report discrepancies and could lead to significant legal penalties, including fines and loss of licensure. Furthermore, it erodes patient trust and compromises the integrity of the pharmacy's operations. Another incorrect approach, such as casually discussing the findings with unauthorized personnel, constitutes a direct violation of HIPAA, leading to potential breaches of patient confidentiality and significant disciplinary action. Failing to secure controlled substances properly, as implied by the audit findings, is a direct violation of the CSA and state regulations, increasing the risk of diversion and jeopardizing public safety. Professionals should approach such situations by first recognizing the seriousness of the audit findings. The decision-making process should involve a systematic evaluation of the identified issues against relevant pharmacy laws and ethical guidelines. This includes understanding the specific requirements for patient privacy, e.g., HIPAA privacy rule, and the secure handling of controlled substances, e.g., DEA regulations and state pharmacy board rules. The CPT should then take immediate, appropriate action to rectify the situation, document all steps taken, and report the findings and corrective actions to the supervising pharmacist and relevant authorities as required. This structured approach ensures that all legal and ethical obligations are met, protecting both the patient and the pharmacy. Question 3. The evaluation methodology shows that a patient presents a prescription for oxycodone 10 mg, 1-tab POQ 4-6-HPRN pain. The pharmacy technician is unsure if this specific formulation and quantity are permissible for a new prescription without further clarification. What is the most appropriate course of action for the pharmacy technician? Option A. Dispense the medication as written, assuming the prescriber has followed all appropriate guidelines for controlled substances. Option B. Refuse to fill the prescription immediately due to the potential for it being a controlled substance and the technician's uncertainty. Option C. Assume the medication is not a controlled substance and dispense it to avoid delaying patient care. Option D. Contact the prescribing physician to verify the prescription details, including the drug, dosage, quantity, and refill status, to ensure compliance with controlled substance regulation. The correct answer is D. Contact the prescribing physician to verify the prescription details, including the drug, dosage, quantity, and refill status, to ensure compliance with controlled substance regulations. Explanation: scenario analysis. This scenario presents a professional challenge due to the inherent risks associated with controlled substances and the ethical obligation to protect patient safety while adhering to strict legal requirements. Pharmacy technician must exercise sound judgment and a thorough understanding of controlled substance classifications to prevent diversion and ensure compliance. The dilemma arises from a patient's request that, while seemingly straightforward, could potentially involve a controlled substance with specific dispensing limitations. Correct approach analysis. The correct approach involves verifying the prescription with the prescribing physician. This aligns with best professional practice because it directly addresses the ambiguity of the prescription and ensures accurate dispensing according to federal and state regulations governing controlled substances. Specifically, the U.S. Drug Enforcement Administration, D, classifies controlled substances into schedules, IV, based on their potential for abuse and accepted medical use. Schedule Roman II substances, for example, have a high potential for abuse and require a written or electronic prescription with no refills allowed, necessitating careful verification. By contacting the prescriber, the technician confirms the drug, its dosage, and its schedule, thereby preventing potential dispensing errors, diversion, or violation of dispensing limits. This proactive step upholds the technician's responsibility to patient safety and regulatory compliance. Incorrect approaches analysis. One incorrect approach is to dispense the medication as written without further inquiry. This is a significant regulatory and ethical failure because it bypasses the crucial step of verifying a potentially controlled substance. If the medication is a Schedule Roman II or Roman III controlled substance, dispensing it without proper verification could lead to dispensing errors, patient harm, or legal repercussions for the pharmacy and the technician. It demonstrates a lack of due diligence and a disregard for the stringent regulations surrounding controlled substances. Another incorrect approach is to refuse to fill the prescription outright without attempting to clarify. While caution is warranted with controlled substances, a complete refusal without seeking clarification from the prescriber is not best practice. This can negatively impact patient care by delaying necessary medication and may not be legally justifiable if the prescription is indeed valid and within dispensing guidelines. It fails to explore a resolution that prioritizes both patient access and regulatory compliance. A third incorrect approach is to assume the medication is not a controlled substance and dispense it. This is a dangerous assumption and a direct violation of regulatory requirements. Controlled substances require specific handling, record keeping, and dispensing protocols. Making assumptions bypasses these critical safeguards, increasing the risk of diversion, misuse, and legal penalties. It demonstrates a failure to adhere to the fundamental principles of controlled substance management. Professional reasoning. When faced with a prescription for a medication that may be a controlled substance, a pharmacy technician should follow a structured decision-making process. First, identify any potential red flags, such as unusual dosages, quantity, or patient history. Second, consult internal pharmacy policies and procedures regarding controlled substances. Third, if there is any doubt or ambiguity, verify the prescription with the prescribing practitioner. This verification should include confirming the drug name, strength, dosage form, quantity, and the prescriber's intent, especially concerning refill information for controlled substances. Document all verification steps thoroughly. This systematic approach ensures patient safety, maintains regulatory compliance, and upholds the ethical standards of the pharmacy profession. Question 4. Research into the impact of a new medication on a patient's existing drug regimen has revealed a potential interaction that could significantly alter the absorption and metabolism of one of the patient's current prescriptions. The patient is asking for guidance on what this might mean for their treatment. As a certified pharmacy technician, what is the most appropriate course of action? Option A. Tell the patient that drug interactions are complex and they should not be concerned unless their doctor mentions it. Option B. Inform the patient that you have identified a potential interaction that requires pharmacist review and will alert the pharmacist immediately. Option C. Advise the patient to adjust the dosage of their current medication based on your understanding of how the new drug might affect its absorption. Option D. Provide the patient with a detailed explanation of the pharmacokinetic changes, including specific enzyme inhibition or induction pathways involved. The correct answer is B. Inform the patient that you have identified a potential interaction that requires pharmacist review and will alert the pharmacist immediately. Explanation. This scenario presents a professional challenge because a certified pharmacy technician, CPT, is tasked with assessing the potential impact of a drug interaction on a patient's pharmacokinetic profile without direct prescriber consultation. This requires a nuanced understanding of how drug absorption, distribution, metabolism, and excretion, ADME, can be altered, and the potential clinical consequences. The CPT must balance providing helpful information to the patient with avoiding the unauthorized practice of medicine or pharmacy. The correct approach represents best professional practice because it prioritizes patient safety and adheres to the scope of practice for a CPT. By identifying the potential interaction and flagging it for pharmacist review, the CPT ensures that a licensed professional with the authority to make clinical judgments assesses the situation. This aligns with regulatory frameworks that define the CPT's role as assisting the pharmacist, not independently making clinical decisions. It also upholds ethical obligations to act in the patient's best interest by preventing potential harm from altered drug efficacy or toxicity. An incorrect approach that involves directly advising the patient on how to adjust their medication dosage or timing would be a significant regulatory and ethical failure. This constitutes the unauthorized practice of pharmacy, as only a licensed pharmacist or prescriber can make such recommendations. It bypasses the established chain of clinical oversight and could lead to serious adverse drug events. Another incorrect approach, such as dismissing the patient's concern without further investigation, would be an ethical failure related to patient care and communication. It neglects the CPT's responsibility to be attentive to patient inquiries and to escalate potential issues. Professional decision-making in such situations should involve a clear understanding of one's scope of practice. When presented with a potential drug interaction that could affect ADME, the CPT's primary responsibility is to identify the issue and bring it to the attention of the supervising pharmacist. This involves accurate documentation of the patient's concern and the potential interaction. The CPT should then allow the pharmacist to conduct a thorough assessment, which may include reviewing the patient's profile, consulting drug interaction databases, and communicating with the prescriber if necessary. Question 5. The efficiency study reveals a significant increase in the target dispensing rate for the pharmacy. As a certified pharmacy technician, you are concerned that meeting this new target might necessitate cutting corners in the verification process, potentially compromising patient safety. What is the most professionally responsible course of action? Option A. Continue dispensing medications at the current pace, assuming that any errors will be caught by the pharmacist during final verification. Option B. Focus solely on meeting the new dispensing rate to avoid any negative repercussions from management regarding performance. Option C. Voice concerns about the new efficiency targets to other technicians during breaks, hoping that collective complaints will lead to a change. Option D. Proactively identify specific steps in the dispensing process that could be compromised by the increased speed and discuss these concerns, along with potential mitigation strategies, with the supervising pharmacist. The correct answer is D. Proactively identify specific steps in the dispensing process that could be compromised by the increased speed and discuss these concerns, along with potential mitigation strategies, with the supervising pharmacist. Explanation. This scenario presents a professional challenge because it requires a certified pharmacy technician, CPT, to balance the demands of efficiency with the paramount importance of patient safety and professional integrity. The pressure to increase dispensing speed, as indicated by the efficiency study, could inadvertently lead to shortcuts that compromise the accuracy and safety of medication dispensing, directly impacting patient care. Careful judgment is required to identify and mitigate risks associated with such pressures. The correct approach represents best professional practice because it prioritizes patient well-being and adherence to professional standards over purely quantitative efficiency metrics. By proactively identifying potential risks to patient safety and reporting them through established channels, the CPT demonstrates a commitment to ethical practice and regulatory compliance. This aligns with the core principles of pharmacy practice, which emphasize the technician's role in supporting the pharmacist in providing safe and effective medication therapy. Specifically, this approach upholds the technician's responsibility to report any situation that may compromise patient care or violate pharmacy regulations, ensuring that concerns are addressed at the appropriate level. An incorrect approach that focuses solely on meeting the efficiency targets without considering the potential impact on patient safety is professionally unacceptable. This could lead to increased dispensing errors, incorrect dosages, or dispensing of the wrong medication, all of which are direct violations of professional conduct and could have severe consequences for patients. Such an approach disregards the ethical obligation to do no harm and fails to uphold the standards of care expected of a CPT. Another incorrect approach that involves ignoring the efficiency study's implications and continuing with existing practices without any attempt to improve or address potential issues is also professionally deficient. While it may avoid immediate errors, it fails to contribute to the pharmacy's overall improvement and could be seen as a lack of initiative or engagement with operational goals. Furthermore, it misses an opportunity to identify and implement safer, more efficient workflows that could benefit both the pharmacy and its patients. A further incorrect approach that involves discussing the efficiency studies potential negative impacts with colleagues in a way that undermines management or creates a negative work environment without taking constructive action is unprofessional. While peer discussion can be valuable, it should be coupled with a proactive approach to problem solving and reporting concerns through appropriate channels. This approach can foster gossip and disengagement rather than solutions. The professional reasoning process for similar situations involves a systematic risk assessment. First, the CPT should understand the stated goal efficiency and identify potential risks to patient safety and professional standards. Second, they should consider the regulatory framework and ethical guidelines governing their practice, particularly those related to patient care and reporting procedures. Third, they should evaluate different courses of action based on their potential to mitigate risks and uphold professional responsibilities. Finally, they should choose the action that best balances operational goals with the non-negotiable imperative of patient safety and regulatory compliance, often involving communication with the supervising pharmacist or designated management. Question 6. Compliance review shows a prescription for hydrocodone syrup 100 mg/5 ml. 5 ml every 6 hours as needed for cough. The pharmacy technician is preparing to fill this prescription. What is the most appropriate initial action for the technician to take regarding the drug classification and dispensing requirements? Option A. Dispense the medication after confirming the patient's identity and the prescription's quantity. Option B. Immediately consult the pharmacist to verify the prescriber's DEA registration number and confirm state-specific dispensing requirements for Schedule Roman III substances. Option C. Dispense the medication as prescribed, as the indication for cough is not a controlled substance use. Option D. Refuse to fill the prescription and inform the patient that hydrocodone is a controlled substance and cannot be dispensed. The correct answer is C. Dispense the medication as prescribed, as the indication for cough is not a controlled substance use. Explanation. Scenario analysis. This scenario presents a common challenge in pharmacy practice where a prescriber requests a medication that falls into a controlled substance category, but the request is for a non-controlled indication. The technician must recognize the drug's classification and understand the implications for dispensing, even when the prescription appears routine. The professional challenge lies in balancing efficient workflow with the stringent regulatory requirements for controlled substances, ensuring patient safety and legal compliance without unnecessarily delaying legitimate treatment. Correct approach analysis. The correct approach involves recognizing that the requested medication, hydrocodone, is a Schedule Roman III controlled substance under U.S. federal law, DEA regulations. Even though the prescription is for cough suppression, which is a legitimate medical use, the drug's inherent classification as a controlled substance mandates specific dispensing procedures. This includes verifying the prescriber's DEA registration number, ensuring the prescription is valid, e.g., not a refill exceeding limits for controlled substances, and adhering to any state-specific regulations that might further restrict dispensing. This approach represents best professional practice because it prioritizes legal compliance and patient safety by adhering to the established framework for controlled substances, preventing potential diversion or misuse. Incorrect approaches analysis. One incorrect approach is to dispense the medication without verifying the prescriber's DEA registration number or checking for any specific state requirements for Schedule Roman III substances. This is a regulatory failure because it bypasses critical steps mandated by the DEA and state pharmacy boards for controlled substance dispensing. Ethically, it risks contributing to the misuse or diversion of a controlled substance. Another incorrect approach is to immediately refuse to fill the prescription because it is a controlled substance, without further investigation. A caution is warranted. Outright refusal without understanding the context, e.g., valid prescription for a legitimate indication, is not best practice. This could lead to a delay in necessary patient care and may not be compliant with regulations if the prescription meets all dispensing criteria for a Schedule III drug. The pharmacist should be consulted to determine the appropriate course of action. A third incorrect approach is to assume that because the indication is for cough suppression, the drug is not subject to controlled substance regulations. This demonstrates a lack of understanding of drug classifications and the legal framework surrounding them. Drug classification is based on the inherent properties and potential for abuse of the drug itself, not solely on its intended use in a specific prescription. This failure to recognize the drug's classification is a significant regulatory and ethical lapse. Professional reasoning. When faced with a prescription for a medication that is known to be a controlled substance, the professional decision-making process should involve 1. Identifying the drug and its controlled substance schedule, federal and state. 2. Verifying the validity of the prescription, including prescriber information, DEA number for controlled substances, and patient details. 3. Consulting relevant regulations, state pharmacy laws, for specific dispensing requirements for that schedule and drug. 4. If any aspect of the prescription or dispensing process raises concerns or falls outside standard procedures for controlled substances, consulting with the supervising pharmacist is paramount. This ensures that all legal and ethical obligations are met and patient care is not compromised. Question 7. Which approach would be most appropriate when a patient presents a prescription for a Schedule II controlled substance that appears to be missing the prescriber's DEA registration number and the patient insists they need it urgently? Option A. Refuse to dispense the medication immediately due to the missing information and advise the patient to return with a complete prescription. Option B. Dispense the medication based on the patient's urgent need and their assurance that the prescription is valid. Option C. Accept a handwritten note from the patient detailing the prescriber's DEA number as sufficient verification. Option D. Contact the prescriber's office directly to verify the prescription and obtain the missing DEA registration number before dispensing. The correct answer is D. Contact the prescriber's office directly to verify the prescription and obtain the missing DEA registration number before dispensing. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's perceived need and the legal requirements surrounding controlled substances. The pharmacy technician must navigate the ethical obligation to assist a patient while strictly adhering to the Controlled Substances Act, CSA, and its regulations, which are designed to prevent diversion and abuse. The technician's role requires a keen understanding of prescription validity, prescriber authority, and the specific documentation required for controlled substances. The correct approach represents best professional practice because it prioritizes patient safety and legal compliance above all else. Verifying the prescription directly with the prescriber's office ensures the legitimacy of the order, confirms the prescriber's intent, and allows for clarification of any ambiguities. This aligns with the CSA's emphasis on accurate record keeping and preventing the dispensing of fraudulent or improperly issued prescriptions. It also upholds the ethical duty to act in the patient's best interest by ensuring they receive necessary medication through appropriate channels, while simultaneously protecting the public from potential harm associated with controlled substance misuse. An incorrect approach that involves dispensing the medication without further verification fails to uphold the stringent requirements of the CSA. This could lead to the dispensing of a fraudulent prescription, contributing to drug diversion and abuse, and exposing the pharmacy and technician to legal penalties. Another incorrect approach, such as immediately refusing the patient without attempting verification, might be perceived as lacking compassion and could alienate a patient who genuinely requires the medication. While caution is necessary, a complete refusal without due diligence is not the most professional or ethically sound first step. A third incorrect approach, such as accepting the patient's verbal assurance or a handwritten note from a third party as sufficient, bypasses the established legal protocols for controlled substance prescriptions, which typically require a written or electronic prescription signed by a registered practitioner. This demonstrates a lack of understanding of the CSA's specific requirements for controlled substance orders. Professional decision-making in such situations requires a systematic approach. First, assess the prescription for any immediate red flags, e.g., unusual dosage, missing information. Second, if any doubt exists, prioritize verification with the prescriber's office, following established pharmacy protocols. Third, if verification confirms the prescription's legitimacy, proceed with dispensing. If verification fails or reveals discrepancies, clearly and respectfully communicate the reason for not dispensing to the patient and offer to assist in resolving the issue, such as by contacting the prescriber on their behalf. Question 8. The review process indicates that a recently received shipment of an over-the-counter pain reliever has been stocked on the shelves. Upon initial visual inspection, the technician notices that the active ingredient dosage listed on the product's immediate container appears to differ from the dosage information typically found on the manufacturer's established packaging for this specific product. Which of the following actions best ensures compliance with the Food, Drug, and Cosmetic Act (FDCA) regarding drug labeling and product integrity? Option A. Alert the pharmacist to the potential labeling discrepancy and await their instruction before taking any further action. Option B. Proceed with stocking the product but make a note in the pharmacy's internal log to reevaluate the labeling at a later date. Option C. Stock the product as is, assuming the manufacturer's labeling is correct and the technician's initial observation may be mistaken. Option D. Immediately remove the product from the shelves and contact the manufacturer for clarification on the labeling discrepancy. The correct answer is D. Immediately remove the product from the shelves and contact the manufacturer for clarification on the labeling discrepancy. Explanation. The review process indicates a potential lapse in ensuring that a newly stocked over-the-counter OTC medication adheres to the stringent requirements of the Food, Drug, and Cosmetic Act (FDCA) regarding labeling. This scenario is professionally challenging because it requires the pharmacy technician to not only identify a potential regulatory violation, but also to understand the underlying principles of the FDCA that govern drug labeling to prevent harm to consumers and ensure compliance. The core of the challenge lies in the technician's responsibility to act as a gatekeeper for product safety and accuracy within the pharmacy setting, even for seemingly simple OTC products. The correct approach represents best professional practice because it directly addresses the potential violation of the FDCA by initiating a process for verification and correction. The FDCA mandates that drug labeling must be accurate, not misleading, and contain sufficient information for safe and effective use. By flagging the discrepancy and seeking to verify the labeling against established standards, the technician is upholding the spirit and letter of the law, which prioritizes patient safety and informed use of medications. This proactive step prevents potentially mislabeled products from reaching patients, thereby avoiding adverse events and regulatory scrutiny for the pharmacy. An incorrect approach that involves simply stocking the product without further investigation fails to meet the professional obligation to ensure compliance with the FD&C Act. This oversight could lead to patients receiving medication with incorrect dosage instructions, contraindications, or warnings, directly violating the FDCA requirement for truthful and adequate labeling. Another incorrect approach, such as discarding the product immediately without attempting to verify its labeling or understand the nature of the discrepancy, is inefficient and potentially wasteful. While caution is necessary, a more measured approach that seeks to rectify the situation is preferable. Furthermore, an approach that relies solely on the pharmacist to identify such issues without the technician taking initial steps to flag potential problems abdicates a crucial part of the technician's role in the pharmacy's quality assurance system. Professional reasoning in such situations involves a systematic approach. First, identify the potential issue. Second, understand the relevant regulatory requirements, in this case, FDCA labeling provisions. Third, take appropriate action to verify and rectify the issue, involving the pharmacist as necessary. And fourth, document the process and resolution. This ensures patient safety, maintains regulatory compliance, and fosters a culture of quality within the pharmacy. Question 9. The analysis reveals that a patient requests a specific brand of a medication that is not typically stocked by the pharmacy, stating a personal preference due to a perceived difference in efficacy compared to generics. The certified pharmacy technician is aware that the pharmacy does stock a therapeutically equivalent generic alternative. What is the most appropriate course of action for the certified pharmacy technician? Option A. Immediately inform the patient that the pharmacy cannot fulfill their request for the specific brand and offer no further assistance. Option B. Inform the patient that the pharmacy only stocks the generic equivalent and consult with the pharmacist regarding the possibility of special ordering the requested brand, if clinically indicated and feasible. Option C. Dispense the generic equivalent as it is therapeutically equivalent and meets the patient's prescription needs. Option D. Attempt to locate the requested brand at another pharmacy and provide the patient with that information without consulting the pharmacist. The correct answer is B. Inform the patient that the pharmacy only stocks the generic equivalent and consult with the pharmacist regarding the possibility of special ordering the requested brand, if clinically indicated and feasible. Explanation. The analysis reveals a scenario where a certified pharmacy technician, CPT, is faced with a request that deviates from standard dispensing practices, potentially impacting patient safety and regulatory compliance. A professional challenge lies in balancing the patient's expressed preference with the CPT's responsibility to uphold established standards of practice and ensure the safe and effective dispensing of medication. Careful judgment is required to assess the legitimacy of the request and its potential consequences. The correct approach represents best professional practice because it prioritizes patient safety and adherence to regulatory guidelines. By consulting with the pharmacist, the CPT ensures that any deviation from standard practice is reviewed by a licensed professional who can assess the clinical appropriateness and legal implications. This collaborative approach upholds the CPT's role as a support professional, while ensuring that patient care is managed within the established framework of pharmacy law and ethical conduct. This aligns with the fundamental principle of patient well-being and the legal mandate for pharmacists to oversee medication dispensing. An incorrect approach that involves fulfilling the request without pharmacist consultation represents a significant regulatory and ethical failure. It bypasses the pharmacist's oversight, which is a critical safeguard in medication dispensing. This could lead to dispensing an inappropriate dosage, formulation, or even a medication that is contraindicated for the patient, directly jeopardizing patient safety. Ethically, it demonstrates a failure to act in the patient's best interest and a disregard for professional responsibilities. Legally, it could be considered a violation of dispensing regulations that require pharmacist verification for non-standard requests. Another incorrect approach, such as dismissing the patient's request outright without understanding the underlying reason or consulting the pharmacist, is also professionally unacceptable. While it avoids dispensing an inappropriate medication, it fails to address the patient's needs or concerns. This can lead to patient dissatisfaction, non-adherence to therapy, and a breakdown in the patient-pharmacist relationship. Ethically, it demonstrates a lack of empathy and a failure to explore all avenues to meet the patient's needs within safe and legal parameters. The professional decision-making process for similar situations should involve a clear hierarchy of action. First, the CPT should actively listen to and understand the patient's request and the reasoning behind it. Second, they should assess whether the request falls within their scope of practice and standard operating procedures. If there is any doubt, or if the request deviates from standard practice, the immediate and mandatory step is to consult with the supervising pharmacist. The pharmacist will then make the final determination based on clinical judgment, patient history, and regulatory requirements. This systematic approach ensures that patient safety is paramount and that all actions are compliant with professional standards and legal mandates. Question 10. Process analysis reveals that a certified pharmacy technician is preparing to dispense a new prescription for a patient. The patient asks the technician for information about how to take the medication and what side effects to watch for. The technician has received basic training on common medications, but is not a licensed pharmacist. What is the most appropriate action for the certified pharmacy technician to take in this situation? Option A. Provide the patient with general information about common side effects based on their training and direct them to the pharmacist for further questions. Option B. Attempt to answer the patient's questions to the best of their ability to ensure the patient receives immediate information. Option C. Inform the patient that this information must be provided by the pharmacist and alert the pharmacist to the patient's request. Option D. Politely decline to answer the patient's questions and suggest they speak with a doctor instead. The correct answer is C. Inform the patient that this information must be provided by the pharmacist and alert the pharmacist to the patient's request. Explanation. Scenario analysis. This scenario presents a common challenge in pharmacy practice where a technician is asked to perform a task that may fall outside their defined scope of practice. The challenge lies in balancing the need for efficient workflow with the paramount importance of patient safety and adherence to regulatory mandates. A technician must be able to recognize the boundaries of their responsibilities and know when to seek pharmacist intervention without causing undue delay or compromising care. Correct approach analysis. The correct approach involves the pharmacy technician recognizing that the request to counsel a patient on a new prescription, specifically regarding its use and potential side effects, is a pharmacist's responsibility. This aligns with the established scope of practice for pharmacy technicians in the U.S., which typically includes tasks such as dispensing, inventory management, and data entry, but explicitly excludes direct patient counseling on medication therapy. By deferring the counseling to the pharmacist, the technician upholds patient safety, ensures accurate and appropriate information is provided, and adheres to federal and state regulations governing pharmacy practice. This demonstrates a commitment to professional ethics and regulatory compliance. Incorrect approach is analysis. An incorrect approach would be for the technician to attempt to counsel the patient themselves. This is a direct violation of the pharmacy technician's scope of practice as defined by state boards of pharmacy and federal regulations. It poses a significant risk to patient safety, as technicians are not licensed or trained to provide medication counseling, which requires clinical judgment and a comprehensive understanding of pharmacology, drug interactions, and patient-specific factors. This action would constitute professional misconduct and could lead to disciplinary action from regulatory bodies. Another incorrect approach would be to ignore the patient's request for counseling, assuming it is not their responsibility. While it is true that counseling is a pharmacist's duty, a complete disregard for the patient's need for information can be seen as a failure to provide adequate patient care. The technician should have a protocol for escalating such requests to the pharmacist, ensuring the patient's needs are met in a timely manner. This passive approach, while not directly violating a specific task prohibition, fails to uphold the ethical obligation to facilitate patient access to necessary information. Finally, an incorrect approach would be to provide incomplete or inaccurate information to the patient, even if attempting to be helpful. This could occur if the technician tries to recall information from memory or consults unofficial sources. Such actions are dangerous and fall outside the technician's authorized duties. The responsibility for accurate medication information rests solely with the licensed pharmacist. Professional reasoning. Pharmacy technicians must operate within a clearly defined scope of practice, which is established by state and federal laws and regulations. When faced with a task that appears to be outside this scope, the professional decision-making process involves 1. Identifying the task requested. 2. Consulting the established scope of practice for pharmacy technicians in their jurisdiction. 3. If the task is outside the scope, immediately deferring the task to a licensed pharmacist. 4. Ensuring the patient's needs are addressed by the pharmacist in a timely manner. This systematic approach prioritizes patient safety, regulatory compliance, and ethical practice. Question 11. The monitoring system demonstrates a consistent pattern of discrepancies between dispensed controlled substances and recorded inventory for a specific technician, raising concerns about potential diversion. According to state pharmacy laws and Board of Pharmacy guidelines, what is the most appropriate immediate course of action for the supervising pharmacist? Option A. Immediately confront the technician and request their resignation. Option B. Report the technician to the State Board of Pharmacy without conducting any internal investigation. Option C. Initiate a thorough, documented investigation into the discrepancies, reviewing dispensing records, inventory logs, and potentially surveillance footage, while maintaining confidentiality. Option D. Ignore the discrepancies, assuming they are minor errors, and focus on other operational tasks. Correct answer is A. Immediately confront the technician and request their resignation. Explanation. The scenario presents a common challenge in pharmacy practice, identifying and addressing potential drug diversion by a staff member. This is professionally challenging because it requires balancing the need to protect patient safety and prevent illicit drug use with the rights and privacy of the employee. A thorough, objective investigation is paramount, adhering strictly to state pharmacy laws and Board of Pharmacy regulations. The correct approach involves a systematic, documented investigation that prioritizes patient safety and compliance with state laws. This includes reviewing dispensing records, inventory logs, and potentially surveillance footage, all while maintaining confidentiality. If evidence suggests diversion, the next steps must align with State Board of Pharmacy disciplinary procedures, which typically involve reporting to the board and potentially suspending the employee pending investigation. This approach upholds the pharmacy's legal and ethical obligations to ensure medication security and patient well-being, while also following due process for the employee. An incorrect approach would be to immediately terminate the employee without a proper investigation. This fails to comply with state employment laws and pharmacy regulations that mandate due process and require evidence of wrongdoing before disciplinary action. Another incorrect approach is to ignore the discrepancies, which directly violates the pharmacy's duty to maintain accurate inventory, prevent drug diversion, and ensure patient safety, thereby exposing the pharmacy to legal and regulatory penalties. Confronting the employee directly without gathering sufficient evidence or involving appropriate authorities could also be problematic, potentially hindering a formal investigation or leading to premature accusations. Professionals should employ a decision-making framework that begins with recognizing potential red flags. This framework involves 1. Objective data collection and documentation. 2. Consultation with pharmacy leadership and legal counsel if necessary. 3. Adherence to established internal policies and state regulations regarding investigations and reporting. And 4. Ensuring patient safety remains the highest priority throughout the process. This structured approach ensures that actions are legally sound, ethically defensible, and effectively address the issue while protecting all stakeholders. Question 12. During the evaluation of a patient reporting a new, unusual rash shortly after starting a new medication, what is the most appropriate initial action for a certified pharmacy technician to take? Option A. Document the rash in the patient's profile, but take no further action until the patient reports worsening symptoms. Option B. Immediately consult the pharmacist and relevant drug information resources to assess the reported symptoms. Option C. Advise the patient that this is likely a common side effect and to monitor it themselves. Option D. Instruct the patient to stop taking the medication immediately and contact their physician. The correct answer is C. Advise the patient that this is likely a common side effect and to monitor it themselves. Explanation: this scenario is professionally challenging because it requires a pharmacy technician to differentiate between a potential adverse drug reaction, ADR, and a common, unrelated side effect, necessitating careful observation and adherence to reporting protocols. The technician must understand the nuances of drug profiles and patient history to make an informed judgment. The correct approach represents best professional practice because it prioritizes patient safety and regulatory compliance. By consulting reliable drug information resources and the pharmacist, the technician ensures that potential ADRs are properly identified, documented, and reported according to established guidelines, such as those outlined by the FDA's MedWatch program. This proactive stance helps in collecting valuable data for drug safety monitoring and can lead to improved patient care and public health. An incorrect approach of dismissing the patient's symptoms as a common side effect without further investigation fails to uphold the duty of care. This could lead to an underreporting of ADRs, hindering the collection of critical safety data, and potentially leaving a patient experiencing a serious reaction without appropriate medical attention. Ethically, this demonstrates a lack of diligence and a failure to act in the patient's best interest. Another incorrect approach of immediately escalating to a physician without consulting the pharmacist bypasses a crucial step in the pharmacy workflow. While physician notification is important, the pharmacist is the primary resource for drug-related information and patient care coordination within the pharmacy setting. This deviation from standard operating procedures can disrupt communication channels and delay appropriate action. The professional reasoning process should involve 1. Actively listening to and documenting the patient's reported symptoms. 2. Cross-referencing the reported symptoms with known side effects and potential ADRs for the prescribed medication using reputable drug information databases. 3. Consulting with the supervising pharmacist to discuss the findings and determine the likelihood of an ADR. 4. Following the pharmacy's established protocol for reporting suspected ADRs, which typically involves completing a med watch form or similar documentation. Question 13. The evaluation methodology shows that a certified pharmacy technician is tasked with preparing a sterile intravenous medication. Which of the following actions demonstrates the most appropriate and compliant approach to ensure the sterility of the final product? Option A. Compounding the medication in the pharmacy's designated non-sterile compounding area, following standard aseptic hand hygiene practices. Option B. Compounding the medication within an ISO Class 5 biological safety cabinet, BSC, after performing thorough hand hygiene and donning sterile gloves and appropriate garb. Option C. Compounding the medication in the pharmacy's open dispensing area, ensuring hands are washed and clean gloves are worn. Option D. Compounding the medication using non-sterile gloves to minimize contamination risk from the technician's hands. The correct answer is B. Compounding the medication within an ISO Class 5 biological safety cabinet, BSC, after performing thorough hand hygiene and donning sterile gloves and appropriate garb. Explanation. Scenario analysis. This scenario presents a common challenge in sterile compounding where maintaining aseptic technique is paramount to patient safety. The technician must recognize the critical importance of environmental controls and personal preparation to prevent microbial contamination of the final product. Failure to adhere to these principles can lead to serious patient harm, including infections. Correct approach analysis. The correct approach prioritizes the fundamental principles of sterile compounding as outlined by USP 797. This standard mandates specific environmental controls, including the use of a cleanroom or an ISO Class 5 biological safety cabinet, BSC, or compounding aseptic isolator, CAI, for manipulations that generate aerosols or require direct manipulation of sterile components. Proper hand hygiene, garbing, and the use of sterile instruments and supplies are also non-negotiable. Adhering to these steps ensures the highest level of sterility assurance for the compounded sterile preparation, CSP. Incorrect approaches analysis. Compounding in an open dispensing area without a primary engineering control like a BSC or CAI is a direct violation of USP 797 requirements for sterile compounding. This practice significantly increases the risk of airborne contamination, compromising the sterility of the CSP and posing a severe risk to patients. It demonstrates a disregard for established safety protocols and regulatory mandates. Using non-sterile gloves for compounding sterile preparations is a critical breach of aseptic technique. Sterile gloves are essential to prevent the transfer of microorganisms from the technician's hands to the sterile components and the final product. This failure directly compromises the sterility of the CSP. Performing compounding in a designated non-sterile compounding area, even with proper hand hygiene and garbing, is inappropriate for sterile preparations. Non-sterile compounding areas are not designed or maintained to meet the stringent environmental requirements of sterile compounding, thus introducing an unacceptable risk of contamination. Professional reasoning. When faced with a compounding task, a pharmacy technician must first identify whether the preparation is sterile or non-sterile. For sterile preparations, the technician must then consult and strictly adhere to USP 797 guidelines. This involves verifying the availability and proper functioning of appropriate engineering controls, e.g., BSC, CAI, ensuring correct garbing procedures are followed, and utilizing only sterile equipment and supplies. If any of these critical elements are missing or compromised, the technician must halt the compounding process and seek guidance or the necessary resources to ensure compliance before proceeding. Patient safety is the absolute priority. Question 14. Cost-benefit analysis shows that a new medication offers significant potential for improved patient outcomes, but its FDA approval status is not immediately clear. As a certified pharmacy technician, what is the most appropriate initial step to ensure patient safety and regulatory compliance? Option A. Verify the drug's official FDA approval status before considering its stocking or dispensing. Option B. Proceed with stocking the medication based on its promising cost-benefit analysis to ensure patient access. Option C. Focus on the drug's marketing claims and potential profitability, as this indicates its value to patients. Option D. Prioritize obtaining the medication due to its potential benefits, assuming it will be approved soon. The correct answer is A. Verify the drug's official FDA approval status before considering its stocking or dispensing. Explanation: this scenario presents a professional challenge because a certified pharmacy technician, CPT, is tasked with evaluating the implications of a new drug approval on patient care and pharmacy operations, moving beyond simple dispensing. The challenge lies in understanding the drug approval process and its downstream effects, requiring a nuanced approach that considers both patient safety and operational efficiency. Careful judgment is required to prioritize patient well-being, while also acknowledging the practical realities of pharmacy practice. The correct approach represents best professional practice because it aligns with the core responsibilities of a CPT to support safe and effective medication use. By focusing on the drug's approval status and its implications for patient populations, the CPT demonstrates an understanding of the regulatory framework governing drug availability and safety. This proactive stance ensures that the pharmacy is prepared to dispense the medication safely and effectively, adhering to all relevant FDA regulations and professional ethical standards. It prioritizes patient access to potentially beneficial therapies while mitigating risks associated with unapproved or improperly handled medications. An incorrect approach that focuses solely on the cost of the drug without considering its approval status fails to acknowledge the fundamental regulatory requirement for a drug to be FDA approved before it can be legally dispensed. This oversight poses a significant risk to patient safety and violates dispensing regulations. Another incorrect approach that prioritizes stocking the drug based on marketing claims rather than official approval status ignores the rigorous scientific and regulatory review process. This can lead to dispensing unproven or potentially unsafe medications, creating liability for the pharmacy and harm to patients. A third incorrect approach that dismisses the drug's approval as irrelevant to the CPT's role misunderstands the technician's contribution to the overall medication use process. While direct patient counseling may be outside the CPT's scope, understanding drug approval is crucial for ensuring that only legally sanctioned and safe medications are handled and prepared for dispensing, which directly impacts patient safety and regulatory compliance. Professional reasoning in such situations involves a systematic evaluation of information. A CPT should first confirm the drug's FDA approval status. Then, they should assess the implications of this approval for the pharmacy's formulary, inventory management, and any specific handling or storage requirements mandated by the FDA or the manufacturer. Finally, they should communicate any relevant findings or concerns to the supervising pharmacist to ensure appropriate patient care and operational adjustments are made. Question 15. Regulatory review indicates a certified pharmacy technician, CPT, is preparing a prescription for a patient with known renal impairment. The prescribed dose of a particular medication, based on standard dosing guidelines, appears to be higher than what would typically be recommended for a patient with this level of renal dysfunction, considering the drug's pharmacokinetic profile. The CPT has access to the patient's renal function test results. What is the most appropriate course of action for the CPT? Option A. Advise the patient to contact their doctor to discuss the prescribed dosage due to their kidney condition. Option B. Dispense the medication as prescribed, assuming the prescriber has a valid clinical reason for the dosage. Option C. Directly contact the prescriber to inquire about the prescribed dosage for the patient's renal impairment. Option D. Inform the supervising pharmacist of the potential dosing issue, citing the patient's renal impairment and the drug's pharmacokinetic considerations. The correct answer is D. Inform the supervising pharmacist of the potential dosing issue, citing the patient's renal impairment and the drug's pharmacokinetic considerations. Explanation: scenario analysis. This scenario presents a professional challenge because it requires the certified pharmacy technician, CPT, to balance patient safety, physician autonomy, and regulatory compliance when faced with a potential medication error. The CPT has identified a discrepancy between the prescribed dose and the patient's known pharmacokinetic profile, which could lead to subtherapeutic or toxic effects. The challenge lies in how to address this discrepancy without overstepping professional boundaries or delaying necessary patient care. Correct approach analysis. The correct approach involves discreetly and professionally communicating the observed pharmacokinetic concern to the pharmacist. This aligns with the CPT's role as a supportive member of the pharmacy team, responsible for assisting the pharmacist in ensuring medication safety and efficacy. The pharmacist, with their clinical judgment and legal authority, can then assess the situation, consult with the prescriber if necessary, and make the final decision regarding the prescription. This approach upholds the principle of patient safety by flagging a potential issue, respects the pharmacist's oversight role, and adheres to the collaborative nature of pharmacy practice as outlined by regulatory guidelines for CPTs. Incorrect approaches analysis. One incorrect approach is to dispense the medication as prescribed without any comment. This fails to uphold the CPT's responsibility to identify and report potential medication errors or safety concerns, directly violating the ethical obligation to protect patient well-being and potentially contravening regulations that mandate reporting of such issues. Another incorrect approach is to directly contact the prescriber to question the dosage. This oversteps the CPT's scope of practice. CPTs are not authorized to independently communicate with prescribers regarding clinical decisions or dosage adjustments. Doing so would violate professional boundaries and regulatory limitations placed on CPTs, potentially leading to confusion or miscommunication. A third incorrect approach is to ignore the pharmacokinetic concern and assume the prescriber has a valid clinical reason. While prescribers are experts, the CPT's role includes vigilance. Ignoring a known pharmacokinetic consideration that could impact patient safety is a dereliction of duty and a failure to act in the patient's best interest, which is a fundamental ethical and regulatory expectation. Professional reasoning. When encountering a potential medication safety issue, a CPT should follow a structured decision-making process. 1. Identify the potential problem, e.g., dose discrepancy based on patient factors. 2. Consult internal resources or protocols if available. 3. Discreetly and professionally communicate the concern to the supervising pharmacist. 4. Allow the pharmacist to exercise their professional judgment and take appropriate action, which may include consulting the prescriber. This process ensures patient safety is prioritized while respecting the roles and responsibilities of all healthcare professionals involved. Question 16. Compliance review shows a prescription for a Schedule Roman II controlled substance has been presented. The prescription indicates a quantity of 30 tablets, but the prescriber's handwritten note on the prescription clearly states dispense 60 tablets. The pharmacy technician is unsure how to proceed. Option A. Refuse to fill the prescription due to the conflicting information and advise the patient to obtain a new prescription. Option B. Contact the prescriber's office to confirm the intended quantity and clarify the discrepancy before dispensing. Option C. Contact the patient to ask them which quantity they believe is correct. Option D. Dispense the prescription for the quantity written on the prescription, 30 tablets, and disregard the handwritten note. The correct answer is B. Contact the prescriber's office to confirm the intended quantity and clarify the discrepancy before dispensing. Explanation. Scenario analysis. This scenario presents a common challenge in pharmacy practice, ensuring compliance with federal controlled substance regulations, specifically the DEA's requirements for prescription validity. The challenge lies in distinguishing between a potentially valid prescription that may have minor technical deficiencies and one that is outright fraudulent or invalid, which could lead to dispensing errors, diversion, or legal repercussions for the pharmacy and technician. The technician must exercise careful judgment based on established legal standards. Correct approach analysis. The correct approach involves verifying the prescription's legitimacy by contacting the prescriber's office to confirm the details, especially the quantity and dosage form, as these are critical elements for controlled substance prescriptions. This aligns with federal regulations, such as the Controlled Substances Act, CSA, and its implementing regulations by the Drug Enforcement Administration, D. The DEA permits pharmacists, and by extension, trained technicians acting under supervision, to make reasonable efforts to verify prescription information. Specifically, for controlled substances, the DEA allows for the correction of certain prescription errors or omissions through consultation with the prescriber, provided the prescriber's intent can be confirmed. This proactive verification ensures patient safety, prevents diversion, and maintains legal compliance. Incorrect approaches analysis. Dispensing the prescription as written without verification, despite the discrepancy in quantity, is a significant regulatory failure. Federal law requires that controlled substance prescriptions contain specific information, including the exact dosage form and strength, and the quantity prescribed. A discrepancy in quantity, especially for a controlled substance, raises a red flag that cannot be ignored. This approach risks dispensing an incorrect amount, potentially leading to patient harm or diversion, and violates the spirit and letter of the CSA. Refusing to fill the prescription outright without attempting any verification is also an incorrect approach. Caution is necessary. Federal regulations do not mandate an absolute refusal for any minor discrepancy. The DEA encourages pharmacists to use their professional judgment and to attempt to clarify ambiguities with the prescriber. This approach fails to uphold the professional responsibility to serve patients when a valid prescription can be confirmed through reasonable efforts. Contacting the patient to ask about the discrepancy is an inappropriate step for controlled substance prescriptions. While patient consultation is often part of prescription verification for non-controlled substances, for controlled substances, direct communication with the prescriber is the legally mandated and professionally appropriate method for clarifying prescription details, especially concerning quantity and dosage. Involving the patient in this clarification process could inadvertently facilitate diversion or create an unprofessional interaction. Professional reasoning. Pharmacy technicians should approach prescription discrepancies, particularly with controlled substances, by prioritizing patient safety and regulatory compliance. The decision-making process should involve 1. Identifying the discrepancy and its potential impact on patient safety and legal compliance. 2. Consulting pharmacy policy and relevant federal regulations e.g. DEA guidelines for controlled substances. 3. Attempting to resolve the discrepancy through the most appropriate and legally sanctioned channel, which for controlled substances is direct communication with the prescriber. 4. Documenting all verification efforts and any changes made to the prescription. If verification is not possible or the prescriber's intent cannot be confirmed, the prescription should not be dispensed. Question 17. Risk assessment procedures indicate a patient presents a prescription for a brand name medication. The prescriber has indicated dispense as written, but also note a preference for a specific generic substitution if the brand is unavailable. The patient expresses a strong preference for the brand name medication due to a previous negative experience with a generic. The pharmacy's insurance formulary indicates the brand name medication is not covered, but the preferred generic substitution is. What is the most appropriate course of action for the pharmacy technician? Option A. Dispense the preferred generic substitution without further consultation, as it is covered by insurance and was noted as a preference by the prescriber. Option B. Contact the prescriber to clarify the dispense as written instruction in light of the patient's preference and the formulary limitations, and discuss potential alternatives. Option C. Dispense the brand name medication as requested by the patient, overriding the dispense as written and formulary information. Option D. Inform the patient that the brand name medication is not covered and dispense the preferred generic substitution, assuming the patient will accept it. The correct answer is B. Contact the prescriber to clarify the dispense as written instruction in light of the patient's preference and the formulary limitations, and discuss potential alternatives. Explanation. Scenario analysis. This scenario presents a common challenge in prescription processing where a prescriber's request for a medication substitution conflicts with a patient's expressed preference and potential insurance limitations. The pharmacy technician must navigate these competing interests while adhering to legal requirements and ethical obligations to ensure patient safety and access to appropriate medication. The challenge lies in balancing the prescriber's clinical judgment with the patient's autonomy and the practicalities of insurance coverage, all within the strict confines of pharmacy law. Correct approach analysis. The correct approach prioritizes patient safety and adherence to legal frameworks. Contacting the prescriber to clarify the substitution and discuss the patient's preference is the most professional and legally sound action. This allows the prescriber to reevaluate their decision in light of the patient's concerns and insurance formulary, ensuring the most appropriate and cost-effective medication is dispensed. This aligns with the legal requirement to dispense the prescribed medication unless a valid substitution is authorized by the prescriber and permitted by law, and upholds the ethical principle of patient-centered care. Incorrect approaches analysis. Failing to contact the prescriber and dispensing the generic substitution without confirmation is a direct violation of dispensing regulations. It bypasses the prescriber's explicit instruction and could lead to dispensing a medication that is not therapeutically equivalent or is contraindicated for the patient. This also disregards the patient's expressed preference, undermining patient autonomy. Dispensing the brand name medication without consulting the prescriber or verifying insurance coverage is also problematic. While it respects the patient's preference, it may not be covered by insurance, leading to significant out-of-pocket costs for the patient. Furthermore, it circumvents the prescriber's directive for a substitution, potentially leading to dispensing a more expensive alternative than intended. Ignoring the patient's preference and dispensing the generic substitution without any discussion is ethically unsound. It disregards the patient's right to be informed and involved in their healthcare decisions. While legally permissible if the substitution is authorized, it fails to address the patient's concerns and can erode trust in the pharmacy. Professional reasoning. When faced with conflicting information or requests during prescription processing, a pharmacy technician should always err on the side of caution and seek clarification. The primary responsibility is to ensure the safe and legal dispensing of medication. This involves 1. Verifying the prescription details. 2. Identifying any potential conflicts or ambiguities, e.g., prescriber's intent vs. patient's preference vs. insurance formulary. 3. Consulting with the pharmacist for guidance when necessary. 4. Communicating effectively with the prescriber and patient to resolve discrepancies. 5. Adhering strictly to all applicable state and federal laws and regulations governing pharmacy practice. Question 18. Implementation of a patient request for a prescription medication that a certified pharmacy technician suspects may be inappropriate or potentially harmful, based on their understanding of pharmacy policy and common drug interactions, requires a specific course of action to uphold ethical principles and ensure patient safety. Option A. Dispense the medication as requested to respect patient autonomy and avoid conflict. Option B. Contact the prescribing physician directly to clarify the medication's appropriateness. Option C. Escalate the request to the supervising pharmacist for their professional assessment and decision. Option D. Refuse to dispense the medication and inform the patient that their request cannot be fulfilled. Correct answer is C. Escalate the request to the supervising pharmacist for their professional assessment and decision. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in the conflict between patient autonomy and the pharmacist's duty to ensure patient safety and adherence to professional standards. The patient, exercising their right to make decisions about their health, is requesting a medication that the technician believes is inappropriate or potentially harmful based on their knowledge and the pharmacy's policies. This requires the technician to navigate a delicate balance, respecting the patient's wishes while upholding their ethical and professional responsibilities. Correct approach analysis. The correct approach involves escalating the situation to the supervising pharmacist. This upholds the principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, by ensuring that a qualified professional assesses the appropriateness of the medication. It also respects the principle of justice by ensuring fair and equitable treatment according to established protocols. The pharmacist, with their comprehensive knowledge and legal authority, can then engage with the patient, explore the reasons for their request, and make an informed decision, potentially involving consultation with the prescriber if necessary. This process ensures that patient care is guided by expertise and regulatory compliance. Incorrect approach is analysis. Refusing to dispense the medication without consulting the pharmacist directly violates the principle of patient autonomy by unilaterally denying the patient's request without proper assessment. It also fails to uphold the technician's duty to seek guidance when faced with uncertainty or potential patient harm, potentially leading to a breach of professional responsibility. Dispensing the medication without question, despite the technician's reservations, directly contravenes the principles of beneficence and non-maleficence. This action prioritizes expediency over patient safety and could result in adverse drug events or inappropriate therapy, exposing both the patient and the pharmacy to risk. It also bypasses established professional checks and balances designed to prevent such occurrences. Contacting the prescriber directly without first consulting the supervising pharmacist is an overreach of the technician's scope of practice. While communication with prescribers is a vital part of pharmacy practice, it is typically facilitated or directed by the pharmacist. This approach bypasses the pharmacist's oversight and responsibility for patient care within the pharmacy setting. Professional reasoning. When faced with a situation where a patient's request for medication raises concerns, a pharmacy technician should follow a structured decision-making process. First, identify the ethical principles at play, Autonomy, beneficence, non-maleficence, justice. Second, assess the technician's scope of practice and limitations. Third, recognize when professional judgment or expertise beyond the technician's level is required. Fourth, escalate the issue to the supervising pharmacist, providing clear and concise information about the patient's request and the technician's concerns. Finally, follow the pharmacist's direction and document the interaction as per pharmacy policy. This systematic approach ensures that patient safety is paramount, ethical obligations are met, and professional boundaries are respected. Question 19. System analysis indicates that a certified pharmacy technician is reviewing a new prescription for a patient who is already taking a medication known to be a potent inhibitor of the CYP2D6 enzyme. The new prescription is for a drug that is primarily metabolized by CYP2D6. Considering the mechanisms of action and metabolic pathways of these drugs, what is the most appropriate course of action for the technician to take to ensure patient safety? Option A. Dispense both medications as prescribed and advise the patient to report any unusual side effects. Option B. Dispense the new medication and contact the prescribing physician directly to question the appropriateness of the new prescription. Option C. Dispense both medications as prescribed and immediately consult with the supervising pharmacist about the potential for increased drug levels and toxicity. Option D. Dispense the new medication and advise the patient to stop taking their current medication due to the potential interaction. The correct answer is A. Dispense both medications as prescribed and advise the patient to report any unusual side effects. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified pharmacy technician, CPT, to go beyond simply dispensing medication and engage in a critical evaluation of a physician's prescription based on their understanding of drug mechanisms of action. The challenge lies in identifying a potential drug interaction that could lead to adverse patient outcomes, necessitating a proactive and informed approach rather than passive execution of an order. This requires a nuanced understanding of pharmacology and a commitment to patient safety, which are core ethical and professional responsibilities. Correct approach analysis. The correct approach involves recognizing the potential for a significant drug interaction based on the mechanisms of action of both prescribed medications. By identifying that one drug inhibits an enzyme responsible for metabolizing the other, the CPT correctly anticipates a potential increase in the concentration of the second drug, leading to an elevated risk of toxicity. This proactive identification and communication with the pharmacist represent best professional practice. It aligns with regulatory guidelines that emphasize the importance of the pharmacy team in ensuring medication safety and preventing adverse drug events. This approach demonstrates a commitment to patient well-being by intervening before a potentially harmful situation arises, fulfilling the CPT's role in the medication use process. Incorrect approaches analysis. One incorrect approach involves dispensing the medications without further inquiry. This fails to meet the professional standard of care and regulatory expectations for patient safety. It represents a passive approach that overlooks a critical pharmacologic principle, potentially leading to patient harm due to drug toxicity. This approach violates the ethical obligation to act in the patient's best interest and the regulatory requirement to ensure the appropriateness of dispensed medications. Another incorrect approach is to dispense the medications and simply advise the patient to be aware of potential side effects. While patient education is important, this approach abdicates the responsibility of the pharmacy team to proactively identify and address significant drug interactions. It places an undue burden on the patient to recognize and report complex pharmacologic issues, which is not a reliable safety net. This approach is professionally deficient as it does not involve the pharmacist in a timely manner to assess and manage the identified risk. A third incorrect approach is to immediately contact the physician to question the prescription without first consulting with the supervising pharmacist. While physician communication is often necessary, the CPT's primary responsibility in such a situation is to escalate concerns to the pharmacist, who has the ultimate authority and expertise to make clinical judgments regarding medication therapy. Bypassing the pharmacist undermines the established workflow and the pharmacist's role in medication safety oversight. This can lead to miscommunication or premature changes to therapy without proper clinical evaluation. Professional reasoning. When faced with a prescription that raises concerns about potential drug interactions based on mechanisms of action, a CPT should follow a structured decision-making process. First, they must leverage their knowledge of pharmacology to identify the potential interaction and its clinical implications. Second, they should immediately consult with the supervising pharmacist, clearly articulating the concern and the rationale behind it. This allows the pharmacist to conduct a thorough clinical review. Third, if the pharmacist agrees with the concern, they will then communicate with the prescriber to discuss potential alternatives or adjustments to the therapy. This collaborative approach ensures that patient safety is prioritized and that all decisions are made by qualified healthcare professionals within their scope of practice. Question 20. Market research demonstrates that a significant number of pregnant patients are seeking advice on over-the-counter OTC pain relievers for common ailments. A patient presents to the pharmacy requesting a recommendation for a pain reliever, stating she is 20 weeks pregnant and experiencing headaches. She has no known drug allergies. What is the most appropriate course of action for the certified pharmacy technician in this situation? Option A. Suggest ibuprofen, explaining that it is generally safe for occasional use during pregnancy. Option B. Recommend acetaminophen, advising the patient to take the lowest effective dose for the shortest duration necessary and to consult her obstetrician if symptoms persist or worsen. Option C. Provide a brochure on herbal remedies for headaches, as these are often perceived as safer alternatives. Option D. Advise the patient to continue taking any pain reliever she has used previously without consulting a healthcare professional. The correct answer is B. Recommend acetaminophen, advising the patient to take the lowest effective dose for the shortest duration necessary and to consult her obstetrician if symptoms persist or worsen. Explanation. This scenario presents a common yet critical challenge in pharmacy practice, ensuring the safe and effective treatment of pregnant and breastfeeding patients. These patient populations require special consideration due to potential risks to the fetus or infant, necessitating a thorough understanding of drug safety profiles and available evidence. The professional challenge lies in balancing the mother's health needs with the protection of the developing child, often in the absence of extensive clinical trial data for these specific groups. Careful judgment is required to navigate the complexities of drug transfer, potential teratogenicity, and effects on lactation. The correct approach prioritizes patient safety and adherence to professional standards by consulting reliable, evidence-based resources specifically designed for pregnant and breastfeeding women. This involves utilizing resources like the FDA's Pregnancy and Lactation Labeling (PLLR) system, reputable drug information databases, and consulting with the prescribing physician. This approach represents best professional practice because it is grounded in regulatory requirements and ethical obligations to provide accurate, up-to-date information and to ensure that medication choices are informed by the best available evidence, minimizing potential harm. It aligns with the pharmacist's role as a medication expert and patient advocate, ensuring informed decision-making for a vulnerable population. An incorrect approach that involves recommending a medication without verifying its safety in pregnancy or lactation is a significant regulatory and ethical failure. This bypasses established guidelines and potentially exposes the fetus or infant to harmful substances, violating the principle of do no harm. Another incorrect approach, such as relying solely on anecdotal evidence or outdated information, is also professionally unacceptable. This demonstrates a lack of due diligence and a failure to adhere to current professional standards and evidence-based practice, which can lead to suboptimal or dangerous therapeutic outcomes. Furthermore, failing to involve the prescribing physician in the decision-making process for a medication change or recommendation in this population can lead to fragmented care and potential drug interactions or contraindications that the pharmacist may not be aware of. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the patient population and their unique needs, pregnant, breastfeeding. 2. Assess the patient's condition and the need for medication. 3. Consult authoritative, up-to-date drug information resources specifically addressing pregnancy and lactation. 4. Evaluate the risks and benefits of the proposed medication for both the mother and the fetus/infant. 5. Communicate findings and recommendations clearly to the patient and the prescribing physician. 6. Document all consultations and decisions thoroughly.